What's up, psychedelic investors? My name's James, and you're watching The Psychedelic Investor, your number one news source for psychedelic stocks. Today, it is my great pleasure to introduce you all to Tim Moore, CEO of Havn Life. Tim, how are you doing today?
I'm doing great, James. How are you?
I'm doing perfect. I'm doing a lot better now that you're here with me. I'm really excited to get into what Havn's all about today.
Awesome. Well, it's my favorite topic to discuss right now, too. So let's
Perfect. So I guess right off the bat, for those of my viewers who might not be the most familiar with Havn, could you just tell us what the company's mission is and how does it hope to achieve it?
Our mission is to improve human performance through the improvement of cognitive health with a focus on evidence-based products, plant-derived, fungus-derived products to improve mental health and cognitive health.
Okay, cool. And how did you personally get into this sphere?
Wow, that is a bit of a story. I'm a career packaged goods guy. I spent 18 years at Clorox. I spent 7 years running the North America Brita business. I worked in consumer electronics, and I transitioned to cannabis 4 years ago after a personal experience. I have 5 sons. My oldest son is 35. My youngest is 24. They're all fine now, but it hasn't been like that all along. 2 of them have anxiety disorder. One was suicidal at age 14. I wouldn't wish that on anybody. My youngest son has Asperger's. My middle son got hit by a drunk driver 6 years ago and was seriously injured, couldn't work for a couple of years, and he became an opioid addict. And ultimately it was cannabis that saved his life. But then when I saw the promise that psychedelics and psychoactives offer for anxiety, depression, PTSD, anger management, substance abuse, I mean, this is the industry of hope. It was very motivating for me and a great opportunity for me to join Havn Life so that we as an industry can help people. So that's what brought me into it.
Wow. So I guess first off, thank you so much for sharing that story. It's really touching and meaningful. And for myself personally, one of the reasons that I got into this industry and started researching all these companies is because our society really is going through like a mental health care crisis, and anything that any company or institution, what have you, that can make a dent in that and really help alleviate some of these sicknesses that we have, it's just a really great thing for society. So I guess I'd just like to say thank you for building a company that's working on these issues. And as hard as it is to have experienced these personal issues, I guess it helps somewhat to have experienced them, to understand what we're trying to defeat. So again, I'd just like to thank you for creating this company in the first place.
Yeah, it's true that we are, as an industry, going to offer hope, because here's the thing: the best that you can actually hope for, if for many people with anxiety or depression, is to find a combination of things that get you numb enough to get through the day. And that's no way to live, and too often that leads to suicide. So the mental health crisis is highly connected to the suicide crisis. We're last year in British Columbia, there were more opioid overdoses than there were COVID deaths, and we didn't shut down the economy for opioids. We've had more soldiers commit suicide than died in Afghanistan, and there's no parade when they commit suicide. So, as the psychedelic industry and Havn Life, our role in it is to provide people with a way to get back to normal, to wake up in the morning and want to have a great day, spend time with a significant other, want to go on vacation, and want to live your life. That's what we offer.
Yeah, and it's really scary because you mentioned the opioid deaths there. I was reading a study recently that said that in Ontario, opioid deaths have risen by 75% since the beginning of COVID. So these crises are just increasing in scale quicker and quicker. And unfortunately, we just, as a society, don't really seem to be giving it the focus that we should be giving it. But I'm so happy that you brought up the veterans point, because I know one of the things that your company Havn is working on is working with Canadian veterans with PTSD, alleviating perhaps their symptoms with psilocybin microdoses. So I was just wondering if you could tell our viewers a little bit about that program. Why did you choose psilocybin, and what will be the milestones and timeline for this project?
So I mentioned the stat around the veterans, and we actually have a veteran on our board. Tim Laidler served in Afghanistan, and he's now the executive director for the Institute of Transition for Veterans at UBC. So he's actively involved with veterans associations all over the world, because that is also a global issue, veterans in other countries. And we've partnered with a group called Heroic Hearts in the UK, the US, and in Canada. And what they do is not only are they advocating for the deregulation of psilocybin and making it available for people, but they run retreats for veterans. So we have a deal that we will be supplying psilocybin to the retreats for their veterans, as well as other activities that we do with them. We hope to be supplying that to them in the second half of this year from our facility in Jamaica.
Okay. And what kind of data are you going to be able to record for this, or how is the data process going to work? They're filling out questionnaires, or?
Yeah, so the retreats are really for treatment, not for clinical trial purposes. Clinical trial is done in a completely different fashion with different rules and expectations. This is really because there's people know they're going to get relief. What we've heard from people that suffer from PTSD is that even a single dose will provide them with several weeks of relief. But and that's what's called a heroic dose, which if your viewers want to really understand what a psychedelic experience looks like, on Netflix there's a show called Goop Labs from Gwyneth Paltrow, and season 1, episode 1, she takes her team to a psychedelic retreat in Jamaica, and they do a really good job of explaining what it is, and you see people go through it. The challenge with the heroic dose is it costs you a day, because you have the profound psychedelic experience. You need to have a guide with you to help you through the emotional experience of that. And for many people, that's a bit frightening. So what microdosing promises is therapeutic benefit without losing a day or a weekend. So, that's where most companies are focusing their research is, can we get to a microdosing protocol that provides the appropriate therapeutic benefit? And our role at HAVN Life is to be the supplier of that active pharmaceutical ingredient, a plant-derived, naturally derived range of products that they can use in their studies and ultimately in formulating products.
Okay, so we see HAVN more as the supplier to others that are doing the clinical trials, and then eventually the hospitals or whoever is performing these ceremonies, what have you, rather than a company that it itself is planning on doing clinical trials, or we're planning on doing.
Yeah, so our primary focus right now is in building this supply chain of naturally derived compounds. At the same time, we are participating in clinical trials in areas that we see are white space, that there aren't a lot of things going on. So we currently have a preclinical trial on immunity and inflammation. So for chronic inflammation like arthritis, for acute inflammation like surgery or an injury. So we're that's in field, and we have announced recently that we're pursuing a transaction to acquire some intellectual property around cluster headache treatment. And cluster headaches are also known as suicide headaches. So we are doing some work there, and the door is open for us to do additional clinical work, but it's a long road to revenue. So what you need is something else that provides revenue now. Our natural health products will be in revenue in the first half of the year. Our API, or active pharmaceutical ingredients, will be in revenue in the second half of the year. So that allows us to be more responsible to our shareholders and not make them hold their breath for 3 to 5.
Awesome. So we actually touched on 2 different topics there I want to discuss. So I guess first we'll focus on the cluster headache issue. So like you said, you are in the due diligence phase to acquire this IP. Assuming that this transaction goes through and you get the IP, could you talk a little bit about how this drug that you're acquiring may differ from Mindmed's way that they're trying to treat cluster headaches, and they're using LSD to do that?
So they're using LSD, which, as you know, is a psychedelic drug and is also a restricted compound. The IP that we're looking at uses bromo LSD, or BOL 148, which is a derivative of LSD but is non-psychoactive. It's kind of like the CBD of cannabis, right? You don't get it. So But this bromo LSD actually has had human trials that show that it is effective on cluster headaches. That's not the IP. The IP is actually combining that with another known compound in a unique and patentable fashion that will enhance the cluster headache treatment. So that's the actual IP. So bromo LSD has been used in the past. It's this combination that's unique and sets us apart and provides some intellectual property rights.
That's very interesting. So would this medication then be something that would be preventative, or it would abort, like you feel the symptoms of the suicide headache coming on and then you take the bromo LSD and in combination with the IP that you're acquiring, or it's like you take it once daily or once a week to prevent them from happening?
Yeah, I'm not sure what the ultimate treatment will be like. That's going to be proven in the trials, but for people that get, I don't know anyone personally that gets cluster headaches, but I know people that get
migraine. Now you do. It runs in my family.
Okay, so in migraines, one of my sons gets migraines. He knows when he's going to get a migraine before he gets it, so he would be able to take it, in advance. So I don't know if you get signals with your cluster headaches or they've just hit you.
It usually actually starts in the morning for me. Like I'll wake up and I'll feel that sharp stabbing pain above my eye, and that's basically all the signal I get, that it's basically game over for the rest of the day minimum for me.
Wow, I'm sorry to hear that. Well, so you will be following this story pretty closely then.
For sure, for sure. And just shifting over to the other thing that you brought up there, the revenue side of things. So you mentioned that you're working with some non-psychoactive substances to get revenue now, as opposed to having to wait, 5 years for these to get through clinical trials. Can you talk a little bit about that?
Yeah, so we're launching in the next few days, actually. We're launching our range of 7 SKUs, 7 different products in the natural health products or nutritional supplement space. And that's actually leveraging a consumer behavior. 75% of people take a supplement on a regular basis for something. I personally take tart cherry for my gout and glucosamine and chondroitin for my arthritis. So to add a lion's mane for clarity of thinking, or cordyceps or chaga or something for the benefit, that is an easy step. So we're launching that range of products and launching our support for that. We'll have an e-commerce site up and will be available at retailers. We've started announcing our retail partners, and that will continue to grow. So that gets us in revenue. It gives us an opportunity to scale across Canada this year, and then to take a look at launching in the US next year. So it's it is an important part of our cash flow that we're able to get into revenue.
So when exactly will people be able to buy those supplements? Later half of the year, you said, or sooner?
In June, you'll be able to go to our website and be able to order it direct, or you'll be able to find it at retailers, which will constantly update the website on which retailers it's available at. And then it'll also be available on places like Amazon later. So, yeah.
That's really exciting. I've personally taken some mushroom supplements before in the form of coffee personally to help, boost my brain signals. So that's very exciting. Is there anything else, Tim, that you'd like to talk about before we decide to close out the interview? Anything really cool about HAVN that you thought you'd like to share with our viewers?
Well, I think what's pretty cool is the company was created, the team was hired, we went public, and we raised money all in a pandemic. And I'm very proud of what the team accomplished. If you've ever been involved in startup, they're a small team. Everybody has to have very high commitment, and absolutely my team has been able to do that. And I'm really proud of what we've accomplished and what we will be accomplishing in the coming months. So watch this space. There's more news to come.
For sure. And it seems like every week we get exciting news from someplace. It's honestly probably one of the most exciting spaces to be watching right now, psychedelic medicines in general. There's so much happening, so much science being done, and so much hope for the future that it's able to deliver.
Right. That's awesome. Well, James, it's been great chatting with you. I really enjoyed it. I hope that you have me back for another chat another day. Okay?
Of course. Awesome. So thank you so much, Tim, for coming. And yeah, we'll talk again soon. Have a good day.